I want to thank everyone for coming today. Hello, my name is Bob Trammell. I'm the Democratic leader in the Georgia House of Representatives. As a caucus, a key part of our mission is ensuring that all Georgians have an equal opportunity to succeed. One of the largest barriers to success is not having access to quality, affordable health care. So with me today are my colleagues from both the House Caucus and the Senate Democratic Caucus here in support of ensuring Georgians have access to health care. In 2016, Georgia's uninsured rate was 12.9%, the fifth highest in the United States. This number is equivalent to about 1.2 million Georgians. 6 rural hospitals have closed since 2013, and over half of the state's rural hospitals are financially vulnerable. In 2012, our state's healthcare system was ranked 45th in the nation. Fortunately, we have a solution to this problem in Georgia. Medicaid expansion is a straightforward solution available to help Georgia tackle these problems. As it currently stands, in order to be eligible for Medicaid in Georgia, individuals between the ages of 18 and 64 must have incomes significantly below the poverty line. Parents with minor children cannot earn more than $7,600 a year for a family of 3 to qualify, and pregnant women cannot have an income higher than $26,500 a year for an individual. Additionally, Medicaid is not provided for single adults without children, regardless of their income. A central piece of the Affordable Care Act is the eligibility so that we close the coverage gap and ensure approximately 600,000 Georgians, our friends, family, and neighbors who will go to bed tonight without health care coverage, who could have health care coverage if we expanded Medicaid. A recent poll by the Atlanta Journal and Constitution found that 75% of Georgia voters support Medicaid expansion. That's because it makes sense. The time is now. It's time to act and to expand Medicaid in Georgia. I want to introduce one of my colleagues in the House, Representative Deborah Gonzalez, for a few remarks. Deborah?
Thank you, Leader Trammell. Thank you all for being here today. What we're going to do now is address some of the reasons of why we need to expand Medicaid and why it makes sense here in Georgia today. Here in Georgia, a single parent with one child loses Medicaid eligibility if they make more than $6,000 annually, but they do not become eligible for subsidies to purchase private insurance until they make above $15,930. This individual then becomes stuck in a coverage gap with no affordable insurance options. About 240,000 Georgians are in a similar situation. They don't currently qualify for Medicaid, but they make too little to get the financial help to buy the health insurance that's currently in the marketplace. Medicaid expansion would close this gap, allowing these Georgians to enroll in quality, affordable health insurance. This would benefit hundreds of thousands of Georgians, including the working middle class and Georgian veterans. The majority of people who would benefit from this expansion are actually employed and working in critical job sectors such as construction, transportation, education, and retail. Georgia's middle class is the backbone of our economy. We ensure that they have access to adequate health care so that then they and this economy and this state can continue to thrive. In addition, closing this coverage gap would extend health insurance to 32,000 currently uninsured veterans and military spouses who deserve our support for all that they have done in service to our state and our country. Finally, as the leader has said before, younger Georgians make up a substantial portion of uninsured adults. It is time to act and to address this gap. Thank you. I would like to introduce now Representative Kimberly Alexander.
Good afternoon. Another reason to expand Medicaid is to improve mental health and substance abuse conditions here in Georgia. According to Georgia Chamber of Commerce, between 2001 to 2015, there was a 360% increase in opioid overdose deaths in Georgia. About 25% of uninsured low-income Georgians who qualify for Medicaid expansion coverage suffer from mental illness or substance abuse. Expanded Medicaid coverage would help more people with mental health needs and substance abuse disorders to acquire the necessary treatment and services. States that have expanded Medicaid have relished its success since connecting more people with mental illness or substance abuse disorder with treatment services. For example, Kentucky experienced an increase of 700% in Medicaid beneficiaries by means of substance use treatment services after the state expanded income eligibility in 2014. Medicaid expansion has significantly increased coverage for states that are battling the opioid epidemic. Another example, West Virginia suffered the highest drug overdose death rate in 2015. But after expanding Medicaid in the state, the share of uninsured individuals who were hospitalized due to substance abuse or a mental health disorder dropped measurably. We need to address this epidemic in our state and expand Medicaid now. Thank you.
Hello, I'm Representative Bill McGowan. The second reason to expand Medicaid here in Georgia is to reduce our uncompensated care costs. In 1986, Congress passed the Emergency Treatment and Labor Act, giving individuals the right to emergency care regardless of their ability to pay. This means that when individuals are uninsured and cannot pay for their health care, the cost is shifted to emergency rooms, tax-funded programs, or private insurance plans in the form of higher premiums. Taxpayers end up paying a share of the cost for uninsured people who show up in the emergency room. In 2015, Georgia's hospitals absorbed $1.74 billion in uncompensated care costs. The more individuals we have uninsured, the more it costs Georgians. Thank you, and Representative Jonathan Wallace.
Thank you, Bill. I'm Representative Jonathan Wallace, and I'm going to speak about the support for our rural hospitals. This burden of uncompensated care costs is particularly high on rural hospitals in Georgia, which is why we need to provide them with the much-needed support by expanding Medicaid. The Georgia Chamber of Commerce states the uninsured rate in rural areas will be 25% by 2026. Since 2013, 6 rural hospitals in Georgia have closed. Over half of the state's rural hospitals, 35 out of 54, are financially vulnerable, according to a 2016 study from iVantage Health Analytics. Improved health insurance coverage leads to increased hospital revenues because hospitals are reimbursed for costs that would otherwise be uncompensated. Hospitals in states that expanded Medicaid were about 6 times less likely to close than hospitals in non-expansion states, according to research published this month in the Health Affairs Journal. To provide some examples, Kentucky experienced a 59.7% decrease in uncompensated care cost after expanding Medicaid, while Arkansas experienced a 56.4% decrease. Medicaid expansion would keep our rural hospitals open by lowering the burden of uncompensated care cost and stimulating economic growth.
So my name is Representative Sam Park, and just wanted to talk about the economy, the economic benefits Georgia would receive if we expanded Medicaid. Medicaid expansion is good for Georgia families and our economy. Currently, just for some context, we're working on bringing in Amazon into the state of Georgia. We are willing to spend up to $1 billion in incentives so that Amazon will spend invest $5 billion in this state, bring in 50,000 high-paying jobs. For every dollar we'd spend in trying to bring in Amazon, be a $5 return on investment. For Medicaid expansion, for every single dollar we spend on ensuring and covering working-class Georgians, that would bring in $9, a $9 return on investment for every single dollar we spend on Medicaid expansion. That create 36 to 50,000 jobs. And according to the Georgia Hospital Association, for every one healthcare-related job that is created, that would support 2 in the community. Expanding Medicaid would strengthen Georgia's economy and provide coverage to hundreds of thousands of uninsured Georgians today. We've heard from Leader Trammell, as well as my colleagues here today, about the reasons why we should expand Medicaid. It would address our uninsured population head-on, which is one of the highest in the nation. It would support our rural hospital systems by reducing uncompensated care, and it would help address our opioid crisis by providing access to those who struggle with substance abuse and mental health issues, as we've seen in Kentucky and Virginia recently. Now, back in 2016, I ran for office to hold my elected official accountable. She voted to block Medicaid expansion in 2014. At the end of 2014, my mother was diagnosed with stage 4 cancer. I learned firsthand the importance of having access to health care, whether private insurance or public health insurance. My mother is alive and well today because of Medicaid and Medicare, and every single time I take her to her chemotherapy appointments, it is a reminder that we have 1.2 million uninsured Georgians today. And so I, along with my Democratic colleagues in the House and Senate today, will continue to fight for every uninsured Georgian in this state, because I know that access to health care is a matter of life or death. And that's not a belief, that's not a talking point, but a fact. So with that, I'd be happy to take any questions. So the estimates to expand Medicaid would cost anywhere between $136 million to $200 million. I think the fiscal report back in 2014 had an estimate closer to $200 million a year. That did not include any of the benefits that would result from increased tax revenues from job creation. A very straightforward solution to raise $200 million in the state would be to increase the tobacco tax, which is one of the lowest already. A 50-cent increase in the tobacco tax would generate $200 million a year. Just last year, we passed more than $400,000 worth of tax subsidies and incentives to generate economic growth. And yet there is a straightforward solution that could help us transform our healthcare system that remains on the table. And this is why we continue to talk about this issue, because this is important.
This issue of Medicaid expansion has become a line drawn in the sand between Democrats and Republicans nationally and statewide. How do you get your Republican colleagues to join you in a bipartisan effort for this?
Medicaid expansion, in my opinion, is common sense and good policy. And I think our Republican colleagues are beginning to understand that. I was on a panel earlier today with Senator Chuck Hofstetler, who is the chairman of the Finance Committee on the Senate side. And he mentioned that they plan on introducing some Medicaid waivers this year. I think there is progress we're beginning to see progress because, again, Medicaid expansion is good policy for the state.
Are Medicaid waivers enough? Is that what you want, or do you want more?
I think if you look at the states that have expanded Medicaid via traditional model and via waiver, the traditional model is more effective and efficient in the long run. So we, as the Democratic colleague in the House and the Caucus, will continue to fight for traditional Medicaid expansion.
If I can add one thing about the cost and on the Medicaid, and thank Sam and my other colleagues who are here. We're in the process of contemplating a $25 billion budget in Georgia. When you put the pen to the paper to do the math on what a $200 million appropriation would be in fiscal year 2019 to literally cut in half the uninsured rate in Georgia, we've got the money. The question is, do we have the priority? And for the Democrats who are here with me, both in the House and the Senate, budgets are a moral document, a reflection of priority. This is our number one issue and our number one priority. We've got the money to do it. And as Representative Park outlined, we are prepared in other contexts to make offers and expenditures for economic development. So this is a multifaceted question. There is an economic development component, but there is a human element for us as Democrats, a moral issue about covering people if we literally accepted the available federal funds by taking that first step and making the commitment to the state level expenditure. And then beyond that, there is widespread recognition in the General Assembly and throughout the state that rural Georgia has a lot of problems. And we're talking about a lot of solutions. But the number one thing that we could do with respect to the health care quality in rural Georgia is expand Medicaid. Any other questions? Thank y'all so much for your time. This is an issue that as long as we, as members of the House and members of the Senate in the Democratic caucuses, have legislative time and legislative breath, we will continue to fight for Georgians who need and can have access to health care. Thank you.